Welcome to our YouTube video series on business and incorporation law for medical and dental professionals. My name's Christopher Neufeld of Neufeld Legal, and in this particular video, we're going to be discussing the unique elements associated with medical and dental professional corporations. And it is because of these unique elements and the specificity that you have to get into to incorporate a professional corporation that so many medical and dental professionals take the opportunity to engage knowledgeable legal counsel to actually do the incorporation. Because it's not a straightforward process as with standardized corporations where you can go into a registry and get it done in a half hour or less. This is a very specific process that is orchestrated by specific provincial legislation and managed and monitored by your professional's regulatory body or association. So let's get into these unique elements. Number one, there are specific naming rules for your corporation that end with the term professional corporation. Now there's slight variances between provinces as to how you use words, what words are permissible, but they are very specific and you have to conform to them and you have to know what they are. Number two, you have to include specific wording in the articles of incorporation. And though that wording is very specific and it makes reference to the limitations and restrictions that are being imposed on your professional corporation. Without that wording, your articles are not allowed to be approved. Third, you need approval from your profession's regulatory body so that once your articles are ready and other documentation associated with it is ready, this needs to be submitted to your regulatory body for the review and approval. And if it's not done right, they send it back and you have to get it done again. Furthermore, whoever's processing it needs to have that confirmation. Otherwise, it's not moving forward. Fourth, your structure needs to conform to statutory restrictions and obligations, especially when it comes to who the shareholders are, who the officers and directors are of your professional corporation. There are very specific rules. You cannot be breaking them. You cannot be operating outside of them. That is how professional corporations work. And fifth, there are additional fees and filing requirements with the profession's regulatory body that needs to be undertaken so that there are additional costs that are going to have to be accrued in undertaking this that goes to the regulatory body. And as a side note, with professional corporations, you're going to have ongoing annual fees and submissions with your professional regulatory body, as well as the fact that any changes that you look to make to the articles or even to the internal structure could very likely require their prior approval before you implement them. Otherwise, your professional corporation again can be put offside. And it's because of all these restrictions, limitations, and expectations that you really should consider getting knowledgeable legal counsel to assist you in undertaking the process. Otherwise, you're going to spend lots of time, run into lots of headache, and not get stuff done properly, especially when this is but the beginning of the structuring that you're looking to do. We're not even talking about tax structuring, business structuring, engagements with others, especially other shareholders, other medical or dental professionals. If you start off wrong in the beginning, you're setting yourself up for disaster going forward. Hence, the importance of doing it right, giving the very unique elements associated with a medical or dental professional corporation. Thank you.